This project will estimate the relative value of VISTA for the Veterans Administration. The Veterans Health Administration is the largest integrated delivery system in the United States, serving 5.3 million patients annually in hospitals, clinics, and nursing homes. The VHA employs 14,000 physicians, 61,000 nurses, and 180,000 full-time employees conducting education, training, and medical research. VISTA is an electronic medical record system used by the VA facilities as well as by health organizations worldwide. The system contains clinical documents, orders, and images. VISTA provides real-time decision support. The features include computerized provider order entry, critical alerts, remote data access, and a clinical reminder system. VISTA serves a broad range of healthcare workers and provides a consistent, event-driven, window-style interface across functions and locations. Healthcare organizations measure two types of return on investment: soft, measuring improved patient care, and hard, measuring direct financial benefits. The IT value framework includes financial, clinical, and organizational features. Financial benefits are derived from cost reductions in administrative and clinical staffing and decreased resource requirements. Clinical benefits stem from advances in patient care processes. Organizational benefits are obtained in improved stakeholder satisfaction. IT healthcare technology tools can be effective in the management of patients in a variety of settings, both large and small. The cost of these technologies can be justified by using return on investment models. In order to determine what the IT costs were for the VA for 2006, 2007, and 2008, data from the Office of Information Technology was used from Table 9. Figures taken from the 2007 Continuing Resolution are used for 2008. To determine the IT expenditures for the Veterans Administration, the totals for medical care from Table 10 were divided by the subtotal veterans from the Unique Patients table. Using the data from this chart, specifically the information for orders, the data was entered into Microsoft Excel in order to create a regression to project IT use for the years of interest 2006, 2007, and 2008. Orders is a surrogate measure for IT use. Extra zeros were removed to facilitate calculations. The linear regression tool in Microsoft Excel enabled the projection of what the IT use would look like for the VA for the desired years of 2006 through 2008. There is now enough data collected in order to complete the analysis required to determine the business value of electronic health records for the Veterans Administration. Using the collected data on IT cost, IT use, and expenditures for the Veterans Administration, as shown above, a correlation analysis was run to determine whether or not there's an association between IT cost, IT use, and expenditures. The analysis shows that increased IT cost led to increased orders, while expenditures per patient per order remained the same on average. It was less likely that increased expenditures per patient led to higher IT costs and increased orders. Meaningful metrics analysis should have a clearly defined variable for testing, and data should be valid. The method of analysis used in this study was limited in a number of ways. The available data was not adequate, which required making projections that may challenge the validity of the study. Specific quantitative data on information technology use was not available, necessitating the use of a surrogate measure. The timeline from which the data were drawn was limited to 3 years or less. Measurements over a short time frame may focus on a trend that is not typical of the subject being studied. Though the methodology of the exercise is useful in assessing return on investment, the data measures selected did not translate smoothly in the analysis.